Welcome to the Mind Matters podcast. I'm Wendy McCarty Van Bemmel. I'm the regional director of our 4 facilities here in Central Florida: Palm Point Behavioral, La Amistad Behavioral, University Behavioral Center, and Central Florida Behavioral Hospital. The 4 hospitals provide a full continuum of care from outpatient intensive programs all the way through residential programs. If you need help or you know someone who does, please give us a call. We'd be happy to help you. I'm so excited to be here today. We're going to talk about peer support. What is it? How does it work? And how can you access it? So I'd love to introduce my wonderful guest host today. I'll start over here with Shani.
Hi, I'm Shani Sloan. I am a community outreach liaison and certified recovery peer specialist for both youth and adult over at University Behavioral Center.
Hi, Wendy. Thank you for having me, for having us. I'm so excited.
Yes.
My name is Yasmin. I use she, they pronouns. I'm the co-founder, executive director for Peer Support Space, and we're a community of people with lived experience navigating mental health struggles, and our vision is whatever someone's going through, they don't have to go through it alone.
Oh, I love that.
Thanks for having me. My name is Corey Fisher. I work for Recovery Connections of Central Florida. I'm a CRPS, and I actually lead the mobile unit team.
Awesome. Yeah. Very cool. Corey, can you tell us just very general? I know we've seen the term float around more recently than ever before, but what is peer support?
So peer support is people with lived experience. So I'm a person in recovery, and I'm someone who helps other people get into recovery, and I inspire hope. I help guide them down the path. Anything that they need, they can bounce off me. And we're generally there for people as like a touchstone.
Got it. So lived experience. I can imagine it being really helpful to talk to someone who's maybe gone through a similar situation. How does it differ, Yasmin, from a counselor or a psychologist?
Yeah, I think so many things are like a yes and. Like,
okay.
I'm so excited that, traditional resources exist, and sometimes I don't want to be fixed or analyzed or assessed or diagnosed. I just finally want somebody to say that really sucks, or I want to learn what works for other people is really valuable. So it's really just a space where, it's okay to not be okay. And a lot of us that have struggled in one way or another our whole life, it's really exhausting to constantly be being fixed, right? So it's being able to have someone walk alongside you, whatever you're going through. A phrase I've heard is, peer support isn't something that's going to necessarily make the rain go away, but it's having somebody walk with you through that rain.
That's really beautiful.
I think the biggest difference that I've seen in the difference between like clinical services versus peer support is the fact that it is so self-directed by the person seeking it. Whereas, clinically, you may say, hey, you need this service, you need that service, this is what you need to do, because someone is trained and licensed to be able to make that evaluation. Peer support is more, if you don't want to get clean, if you don't want to, whatever it is, you just want to get better, like, I'm willing to support you in whatever that looks like. So, if someone's making goals or decisions that maybe I wouldn't do, like, I can give, hey, like, this is what I would do in that situation, but like, let's get you to what you want to do and take those little steps first. So it's definitely the true meeting people where they're at in the community. Clinically on paper, someone might have it all together. They might be living in a sober living, having a supportive environment, have a therapist, have a psychiatrist, but there's still those aspects of life, mental health and substance use that are going to continue to show up that can't be, like Yasmin said, can't be fixed. They just exist alongside the person. So
I can imagine too, like, just seeing someone who's gone through something similar like you have is got to be like, oh my gosh, there's hope. Like, this person is doing it. If they can do it, then maybe I can do it too.
I 100% agree, because that's the only time that worked for me. So I lived in addiction for 10 years, and I went to different treatments. I went to different therapists. I tried everything you can think of, and I never saw a version of myself in those facilities. And so I was like, what am I even doing here? Do they even care about me? Can I ever be better, right? And I remember just crying in my bed, always thinking, like, this is going to be my life forever. And it wasn't until I finally went to a treatment that had peer support and I saw what it looked like on the other end, and someone was like, I've been there, I share your same story, and this is where I'm at now. Did it really like click those puzzle pieces together? And it made me think, okay, I can really do this, and
this.
I can be there.
Yeah.
So it was
Yeah.
amazing.
I've got chills just listening to your story. That's amazing. Yeah.
One cool thing I think that Yasmin's done with Peer Support Space has been being able to have those groups that have nothing to do with what you're going through, but just being able to exist amongst people. Like there was this, you did a like friendship bracelet making one, and I was having a bad week, and I was just like, you know what, I just need to be around people. And it was nice because I could just say, hey, you know, I don't feel like socializing to the people around me. They'd be like, okay, I'll just sit with you. And it
That's
was
powerful.
beautiful. I went home feeling like felt decompressed. I felt supported. I felt, you know, okay, like I could just go to like a cozy gathering, be myself, and say, hey, like I just need to be around people who get it.
Yeah, I think that, you know, we all, sometimes I say we're socializing for the socially anxious is how I explain us when we're like tabling, and it's like, I have 5 seconds to explain what we are, right? But I think a lot of us either have a support system and we know how much it means to us, or we don't have a support system and we know how much we long for that. You know, your therapist, your outpatient resources, they could be a part of your support system, but to really have somewhere to go each day between those appointments or, you know, while you might be waiting for support, I think is really important. And yeah, to just have spaces where it's okay to not be okay and we could connect with others and not mask. There's a certain level of masking that we're kind of taught to do in society where we can't lead with, you know, these are my struggles. So even though we have a lot of similar lived experiences, we don't even know because we're all struggling in silence, right? So to have spaces where like, I could just be depressed and anxious and I can stim and I can share space without talking and that's normal, you know, it makes a lot of a difference for people.
I love good parallel play.
Yeah.
Nothing
Speaking
beats
of
sitting
that,
down.
tell us a little bit about Peer Support and the new respite center that you guys just opened.
Yeah, so Peer Support Space just opened a Peer Respite. It's the only one of its kind in Florida, but it's a non-clinical voluntary space where you could just get away for up to a week. I think we've all been in a place in our life where I'm not necessarily looking for treatment. I need to stare at a wall for 3 days and like that needs to be okay, right? So it's a space where, you know, you're surrounded with other people that have similar lived experience. You can interact with them if you want to. We have scheduled activities. Yeah, you could do if you want anything from like a karaoke party to puzzles to making a rap plan or some more traditional things, resume building, but also ongoingly I could check out art supplies. I could check out, you know, whatever it might be. So, you know, I think a lot of times we just need to get away for a little bit. And, you know, I might be in a position where I can afford a vacation. And I have a vacation 4 months from now. And that is keeping me waking up each day. Like I am looking forward to that, you know, but I think everybody, the same way everyone deserves a support system, everyone deserves a break. But like, where do I get that? So it really kind of also fills these gaps of like, I know I'm breaking down. I need to do something for myself. I'm not in crisis. You know, I don't necessarily need residential treatment at this time, but like, where do I go? You know, at what point
And I
do we
can
kind of
imagine too, coming out, you know, working in our hospital systems, we're predominantly inpatient care. So a lot of times what we see is individuals that have had this wonderful healing experience at our facilities, but the transition back to maybe the stressors in your life, school, family, it's difficult. So I can almost imagine that as a nice transitionary period too, to kind of ease back into your normal everyday life, but also have that support around you as well and build new friendships and relationships.
for sure that. Go ahead.
No, sorry. I also think it's great that it's so destigmatizing, right?
Yes.
Because we get caught up in the narrative of like, oh my gosh, I have to go to treatment for help. Or if I go to like a crisis stabilization, like I'm in crisis. And sometimes you're not in crisis, but you can get there. And so having that safe space to go even before crisis and knowing it's so like destigmatizing and you can take that break away to come back refreshed, I think it's like super crucial.
Well, it's a great catchment area. It's like someone can come if they're in between like okay and crisis. we can catch them right there. And, you know, if they continue to, after 7 days of peer support, connection, and community, they still feel certain ways, like they can go get more help. But like
Right.
a lot of times, like just the community removal from environment and connection to community resources makes such a huge difference, which is why, like, you know, having the drop-in center at Recovery Connections and being able to have all the groups that you guys have, it's like exactly what you said. It's in between appointments, we have life, you know? Like, how do we navigate life on life's terms when, you know, we've been given like coping skills and mechanisms and all the on paper stuff we should do, but then it comes down to it and it's like, well, I don't know how to apply it. How am I supposed to apply it if I haven't been
Practice it,
shown?
or yeah. Can you talk a little bit about what UBC is doing with peer support in the inpatient setting?
Yeah, absolutely. I think ever since I started working there, I've taken what I like to call, like, I'm a little over involved is what I used to say.
Okay.
But what I found was that I was having people from the community reach out to me and say, hey, Shani, this person, we've picked them up a few times to come into places. They are really struggling. This is their first time in treatment. There was all of these times where I was like, I'll be by the facility. You know, I'm going to be by it anyways. I'll drop in. Some of our staff members were like, hey, they want to leave, you know, against medical advice. You know, we really think they should stay. Can you come and talk with them? And I found myself organically doing what I now see as peer support after, you know, getting trained and certified. And I was pushing so hard to implement it because of the benefits of it. So now we have Corey and a couple other peers over at UBC working with our patients in detox. And, you know, it's only going to grow from there is the hope. But I mean, we have seen the benefit so much. I mean, we have a decrease in patients leaving against medical advice. We have an increase of patients going into a higher level of care post-treatment. We have people coming to UBC and then going to Recovery Connections and having months and months and months of documented success. And it's like,
It's amazing.
it's beautiful because the thing is when you sit with your, you know, I get to say sometimes to them, I'm not your therapist. I'm not your discharge planner. I'm just
Right.
a person who cares about you.
So you're
and
not
wants-
providing clinical treatment.
Correct.
But you're like, what does it look like when you're at UBC doing peer support? Like, what would someone get with that?
Yeah, I mean, it starts as a conversation. So, what are you trying to get out of this? What does your recovery look like?
Yeah.
We do a recovery management plan, which is completely self-directed, and we've used evidence-based practices based off different domains in their life, right? So it's housing, transportation, financial and legal. It could be as simple as community supports, religious supports, whatever they want. And they say, this is what I identify that is either a barrier in my life or I lack the support in. And then we start making SMART goals with them on how to achieve those supports so that then when they leave, they can get sustainable recovery.
It's nice because we have our clinical team focusing on the next clinical steps for them, and we have our peer specialists working on the next step for them in the community. It's, you know, do you want to make a meeting list? Let's make a meeting list of community-based recovery program meetings in your area. Okay, you don't want to, you know, do complete abstinence after this. How can we support you? It's more about supporting what someone wants instead of just their
Self-directed.
Absolutely. You know, especially if someone's leaving AMA, if I've talked with them for an hour extensively and they've made that decision, you know, what I say is, okay, you know, let's make a plan at least. If you're going to leave, do you have a safety plan for your recovery? And it's allowing people to make the decisions they want to make while allowing them to feel supported. So it's been beautiful seeing just the difference that we can make with, I mean, a 20-minute conversation. And doing those recovery management plans, we get actual numerics for like, this person increased their recovery capital by 70-something%. And like, I love data personally.
No, that's really cool.
And
That's
so
really
being
cool.
able to see like tangible things happening and changing has been really, really cool, which I imagine, I mean, you guys have been operating since 2019. And like, I mean, it's been 5 years, half a decade, and you guys have, I mean, the respite is beautiful from pictures I've seen, and I'm excited to tour, but it's beautiful, and I'm really excited to see where it goes.
Yeah, I appreciate that. And something to what you were saying that I really love about peer support is that it really meets people where they're at and welcomes like a harm reduction approach, right? So a lot of times there's different things where it's very black and white of like, this is the way you should do this versus asking people like what works for you or how can I meet you where you're at.
Yeah.
Because a lot of times when we just give people this like black and white approach, it might feel unattainable and then like, I'm not even going to try. Right. But if I can kind of take baby steps with you or like, okay, you're going to do this. How can, we do it as safely as possible? Or how can I make sure you're at least not, doing this alone or whatever it might be, is also life-saving and important.
Yeah. I firmly believe in it. And I've seen the added benefits it's brought to our teams at the hospital. And I see where the focus is shifting and we're seeing more peer support. So you mentioned that you got your certification in peer support. What kind of qualifications or what does the certification look like? Or someone who's going to come in and provide peer support? Like, what is their background? Yeah. What's that certification like?
So there's a couple different, so there's the CRPS, which is the main certification, the Certified Recovery Peer Specialist, but you get denoted a lived attestation that you choose. So there's youth, adult, veteran, and family. Did I miss any?
Yep.
And so family is someone who has experience with navigating the mental health or substance use support in the community as well as treatment for family and friends.
Okay.
And so like a lived experience of a loved one. I have both my youth and adult. For youth specifically, you have had to experience a life struggle from age 14 to 25.
Okay.
It could be mental health, substance use, justice involved, foster care system. And you have to get your certification between ages 18 and 29 for that one. So it's
interesting.
a little bit of there's no like time specific one on the adult certification outside of 2 years of lived active recovery. There's no like complete abstinence, no defining on what recovery is. So 2 years of active recovery for an adult, and it's 500 work hours,
about 500 work hours, a 40-hour course.
Okay.
Detailing mentorship, advocacy, ethics, professional responsibility,
relationship building, rapport,
wraparound care.
Yeah, so it really goes through a lot of the different things that we practice. I think with veterans specifically, it goes through, exactly how they could support someone as a veteran and what that lived experience looks like. But the courses were great on teaching me how to use my lived experience as a tool and not just as hey, I'm a person in long-term recovery too.
Yeah.
It's like I can utilize it and know when to appropriately self-disclose and use it as motivation. But, it took me, since I did youth and adult at the same time, I didn't have to, but I did 2 separate trainings for it because the difference in peer support for adults and youth is so different.
Yeah.
Because there are parents involved, there is a family system involved. So it does differ a lot with that, for me at least.
Sure.
Yeah, peer support is a valid field. We're trained professionals, right?
Yeah.
At the end of the day, as cool as we may seem. But yeah, I think, there's the state certification. At its core, peer trainings are how can I provide support and make sure that I'm deconstructing any power dynamics and things are mutual, that it's voluntary, that it's self-driven, right? Yeah. Really looking at the core values of peer support. At Peer Support Space, we are state certified and we do additional training outside of that. And something I really love that we do is ongoing co-learning. So instead of saying like, here's this topic that I'm a subject matter expert on, it's kind of like, here's something that's helpful for me. This is what it looks like for me. How about y'all? So it's like ongoing skill sharing. So
Sure.
really bringing the values of peer support into training too, which has been really valuable for us.
That's really cool. Corey, so what's it been like as a peer support specialist? Like, has there been a moment that like really touched your lives working with someone or, how has it affected you personally?
Yeah. I mean, every day it really touches my heart. I say I'm spiritually full every single day when I do this work. There's just sometimes when you work with someone and, they are chronically homeless, they are on the street, they have no hope, and you're able to provide resources for them and you're able to support them, and then you can see that growth. So specifically with the mobile team, we bring our services out to community partners. We believe that meeting people where they're at isn't just mentally, but it's also physically.
Yes.
And so sometimes people can't get to an office space, right? Transportation is a huge barrier. So one of my favorite success stories is we work at a homeless services hub, right? We met this person who has been homeless for 3 years, suffers from substance use disorder. One of our peer specialists, Chris, met him where he's at, sat on the pavement and had an hour-long conversation with him. 2 weeks later, he called our 407 Recover hotline, Recovery Connections, and we did our intake with him. We were able to get him to treatment immediately that day because we have so many connections to all the different great resources. He now is gainfully employed. His recovery capital scale, I believe, started at 75, which is considered critically low. Under 90 is considered critically low. They start at the lowest point of Maslow's hierarchy. So food, shelter, water, fire, and active addiction, needs the basics. He's now at a 175.
Wow,
That's crazy.
that's awesome.
Yeah. So, I mean, it's just amazing to see, like, what you can really do for someone, and that's in less than 6 months. And that's just
Amazing.
providing that support and being there for someone, people who are generally marginalized and never really had that support system.
That's amazing. I love that.
It's great what, like, for me, what's like common sense and practiced and like things that I've like mastered, which is like, getting someone into treatment, like I can navigate that like this. Mm-hmm. Someone who's in crisis or someone who wants to enter recovery or whatever that looks like, they may not have the capacity to be able to do that. And for me, it's like, it's something 5 minutes of my life doesn't make a huge difference when I look at, the 20 minutes I spent at the Starbucks drive-thru this morning. But that 5 minutes I spend on the phone with someone or talking with someone in person could change their life by just being able to provide them a few resources that I just know because of being in this field.
Yeah, the whole trajectory of their life. Like, that's a pretty powerful 5 minutes,
It's just like a little gentle turn and then and then like a push forward.
And I think a lot of people, I've been in this industry for a long time, is when you're seeking out help, you're like, okay, I'm mustering it up. I'm going to make one phone call. And then if, they don't have the care you need or your insurance isn't covering it, like, okay, like this is too much. I'm not going to do that. So I can imagine peer support also being just kind of like a lifeline. Like, let me wrap my arms around you. I'm going to support you where you're at. And like, we're going to do this together. You're not alone.
Yeah. And, it's really impactful when you make like an ABC plan, right? So a lot of times
Tell us about that. What's an ABC plan?
So I define it as, this is your plan A. If plan A doesn't work, this is your plan B.
I
If
got
plan
it.
B doesn't work, this is your plan C. And, a lot of times when you're in crisis or when you're in active addiction, you can maybe just make that one phone call.
Yes.
And if that was not successful, game over. We're back to crisis. We're back to active addiction. And so working with a peer specialist, we'll make these plans with them and we'll guide them through those steps. So if plan A doesn't work, we move on to plan B. If plan B doesn't work, we move on to plan C. But it gives them some sense of security that, it's not an all or nothing thing. There's different pathways. There's multiple pathways. And we can still get to the same end result, even if the first step didn't work.
Yeah. So. And you're not hanging up the phone and leaving them. You're standing there with them.
And keep reworking until you finally get it right.
And I'm learning a little bit about the family peer support certification too. I'd never heard of that before. I can imagine for families not knowing where to turn or how to help their children and loved ones, that's got to be really helpful too.
Yeah, definitely. I've seen a few of the like recovery high schools have family peers to help with how to navigate your loved one, experiencing mental health issues, or how my mom would never go to a Nar-Anon or Al-Anon meeting. And that's fine.
Can you explain what that is?
So Nar-Anon and Al-Anon is where people, it's the sister programs to NA and AA. Mm-hmm. So it's where people are experiencing, supporting a loved one through their addiction, and they can go and work on themselves, find community, really work on the way that their loved one's addiction has affected them.
Yes.
And work on how they can work on themselves to be a better person of support for, and that includes not enabling, supporting versus enabling and what that looks like.
Sure.
Whereas a CRPS-F with the family denotion is going to be like, okay, let's get you connected with some of these meetings, but also, are you in family therapy? Are you, how can you talk to them, your child as an individual and not just your child? There's a lot that goes into it that, I wish I knew a little more of, but it's definitely cool to see the work that the family peers are doing. Because I mean, helping with communication to and from facilities, it is really hard to be impartial sometimes when your loved one is experiencing something that affects you. It's hard to be like, I need to be impartial and objective in this, whereas a peer can step in and be that mediator, kind of.
Yeah, I know you run a group over at one of our residential facilities, La Amistad, with teens. Yeah. Tell us about what that is like. What are you seeing? Any specific trends or?
Yeah, I first of all love my kiddos there.
And I'm sure they love you
they
too.
Keep me young. I will say I am young, but they taught me like a few new slang terms recently, and I was like, I'm out of it now. But I've seen mainly the biggest trend I've seen is kids thinking that they're too young to be addicts, so it's too young to get clean. I find that I lost a lot of friends before they ever turned 18. And so I reaffirm with them a lot of times that, like, you know, how many of you have friends who've died from overdoses, or friends that, you know, like have suffered major consequences, are in jail serving adult sentences as minors? You know, are you willing to put yourself through that? And the biggest thing is, you know, well, it's not bad now, or I'm not using these drugs. And I tend to, in that group, talk about how, for me, addiction is neural processing. It is, the other day I was like, you ever sit down and you go to play a video game and you're like, I'm only going to play for an hour, and then the sun rises, and they all they were like, oh my God, yeah. And I was like, that for me, that's addiction. Like, that's how I experienced addiction before I ever picked up a drug, was obsession and compulsion as a kid. And talking about what it was like for me as a kid to biologically have that kind of set up for me has been helpful for them. But it's definitely a trend of I'm seeing a lot of like addictive behaviors before ever picking up a drug, and then once they pick up a drug, or even self-harm being used as, you know, as a drug of choice, you know, being addicted to that release. It has been that co-occurring self-harm, eating, and drugs, and they see them as separate issues. And being able to look at it as like, this is one core issue of wanting to escape whatever you're feeling, has helped a lot. But man, the ones that get it are driven. Like I literally have chills. I've seen a few of them who I give them my number and they like keep in touch. Some of them, there's one that has like 7 months in, she's working like a community-based recovery program. But not even just that, like she graduated high school. She got a huge scholarship to college. Like she didn't think she was going to graduate. There was another one who stayed in the program till she was 18 and chose to go to a sober living because she knew that her home environment wasn't going to be best for her. So it's cool to see kids be treated as individual humans, because they're their own person outside of parents. And it's getting both the kid and the parent to understand that they can make decisions together. Yeah. But yeah, I love talking with them. I actually have my group tonight, so I'm excited to talk with them.
It also must be so invaluable to them to see someone who is young and in recovery, because I know that's what kept me out of recovery for so long, because I couldn't see myself in anyone that was in recovery. And so I just think that's so important is, if we don't have good role models or role models we want to be like, then why are we doing this? You know?
You guys have so many peers that work with you guys. Like, I can imagine that if someone doesn't find someone with the lived experience that they resonate with, that it's a nice feeling to be like, okay, there's more peers.
Yeah, I think something that I really appreciate about peer support space, I mean, we have spaces for anyone 18 and up, the respites for anyone 18 and up, and we really have a focus on providing diverse peer support, right? So kind of that, is there someone who looks like me and talks like me? Code switching isn't just for the depressed and anxious, but it's also, you know, sometimes I come off a little bit less LGBTQ plus leaning. Like I don't know the environments, like I have to code switch. So I think it's really valuable to make sure that you have diverse lived experience. And even then, like I'm not a monolith for every Hispanic person and their experiences, right? And something that I also like about the diversity of our lived experience is a lot of times peer support can focus on substance abuse recovery, but we really also focus on mental health. And there's certain things like I'm not trying to cure my autism. Like I will always be autistic, right? Like I'm not going to be cured of my PTSD. Like this is just kind of something I live with, right? But also just understanding, like, mental illness aside, recovery aside, like we are people that struggle and like there's connection to be made over that. So it's something I really appreciate about the lived experience of our peers, of just, you know, being able to not always pathologize everything.
I love that you said that. Yeah, it's maybe I have a diagnosis and this is me and this is me, and it's not just I have a diagnosis and that's it.
And being defined by it.
Yeah.
Absolutely. Yeah. It's been, I mean, it's super cool to see like the chronic illness groups. There's like the intersection groups, you guys, where it's like, okay, this group of people and this intersection of people that are underserved within that group. And so it's like intentionally making those spaces, because when I was ready to get help, I went to a meeting on a college campus and I was like, I'm going to see someone like me.
Okay.
And they were all in their 40s. And I was like, oh no. and then I went to a meeting that was LGBTQ safe space. And I was like, I'm going to see someone like me. And there were no other young lesbians. And I was like, oh no, I wasn't yet ready to admit that I had an issue. I wasn't ready to label myself as anything, but I'm like, I'm a young person struggling with drug use. I'm a gay person struggling with drug use. And I wasn't yet able to accept help until it was like more specialized.
Sure.
Sometimes people, I find that people say like sometimes creating those carve outs for that space can be limiting, but I find it creates access to it rather.
What are some of the groups that you guys are offering right now?
Yeah, so we have currently 75 groups a month. That's been our average for the last 2 years. Yeah. And a mixture of in-person and virtual, as well as a mixture of general groups where we kind of take turns venting. At the end, you get to say, I just want to vent, or I'm open to words of support. I'm open to advice from a place of I. But we also have identity focused spaces. So 22 of those, very unique. These are communities. If a group exists for it, we're referring. But things like LGBTQ plus Asians, or aged out foster kids, or people living with chronic pain. So, you know, understanding that I think we know that like not all communities have equal access to mental health care.
Yeah.
And a big part of that isn't just like financial access, but also accessing culturally affirming care. And nobody understands the cultural nuances of a community like a community itself. I can't learn what it is to like be a Black trans person in a book, you know, like certain things you just can't teach. So I think those identity focused spaces are really powerful. And then last year we also started adding activity based spaces. People are like, well, find what works for you. But like, I don't even know what to do with my hands. Like, where do I start? Like if I join a meetup, there might be like hobby snobs, right? So spaces where
the girl with the whole basket full of beads. And I'm like, I came with string.
Yeah, exactly. So just spaces for all experience and anxiety levels are welcome. And then also we started adding those like the cozy crafting, the low spoon socials, because it got to a point where, you know, we have groups twice a day, every day. And there came a point where we're like day 300, still depressed, no update, you know, but it was okay, we want to like show and tell and trivia and color and, you know, just really hang out. So I really appreciate the diversity of the groups, because now I can come to the respite, but when I leave, now I have a support system, or maybe I'm coming to La Amistad, and now when I leave, I have a support system, or, you know, whatever it might be.
Absolutely. I'm going to ask each of us to go around and maybe have one last question. If you can tell us, you know, what inspires hope in you, and maybe a song or a podcast or something that you're really into right now.
What inspires hope in me? This type of work. Every single professional I've met in this line of work in behavioral mental health, addiction specialties, truly cares about that individual. And that's so different to see in the medical professional. And so I think that really inspires hope. Everyone does care. I've been reading a book. I cannot remember the name of it, but it's The Alchemy of the Soul, especially.
Okay.
It's about transmuting like the energy from negative to positive. And I just love that it speaks to me spiritually. So.
Oh, I love that. I'm going to have to check it out.
Yeah, I'll get you the name.
All right. Thank you, Corey.
You're welcome. Thank you.
Yasmin?
Yeah, something that brings me hope is just hearing so many people's stories. You know, we talked about how sometimes you live in a world where people don't really talk about their mental health. So, like, what a unique experience to be trusted and let into people's lives. I mean, I'm sure y'all have experienced it where people are like, I've never told anyone this. And they're like in their 60s, like coming out, you know? So just like really being able to see other people lets me know that, like, when I'm feeling hopeless, I've met people that have told me they're hopeless and I've seen them have good moments. So I feel like I can have those good moments too. So it's really inspiring to be able to, like, be let into the stories of others, and quite literally, like, what they've been able to accomplish, like, brings me hope. And whenever I'm stressed, I just feel like someone says something nice, and lately I've been trying to write that on a sticky note and put it in my mirror, make it an affirmation until I absorb it.
Love that.
So yeah, the community brings me hope. I mean, people, like, they're really lovely. Like, there's a lot of parts of just being human that are really wholesome, for like a lack of a better term. And then honestly, as far as like podcast, book, song, I'd love to be inspirational, but I really just watch like trash reality TV.
And that's okay.
When I'm not working, and I think
It's mindless. It's great.
Yeah, we need distraction. We need numbness. Like, life is really hard. So, like, yeah, I'm kind of embarrassed by like my.
You don't have to be embarrassed. I think we can all relate.
That realm. It's in there. Yeah.
I love the
You
realness.
feel comfortable with saying I love trash reality
Okay,
TV.
cool.
Same, so you're supported.
Fully.
Here's support in action.
Yes.
I think for me, I think seeing how much the community is changing has inspired a lot of hope in me. Like, feeling like even though I'm doing what I feel like are very, very small things, they have big ripples. So, like, even though, you know, I might be working with one patient at my facility, I'm one facility amongst thousands, and I'm one person talking with one other person, but that person can go on to help someone, and those people can go on to help people. And like, just the think, whenever I feel like small and like little in this job, because it can be isolating for me at least, to hear so much need and then not be able to just help. You know, I'd say like that sucks. And sometimes I feel bad that that's all I can do, even though it is reaffirming for someone else and it's reaffirming for me to hear. I want to do more. And what I find is that the community is really changing to provide those more resources that, you know, things like peer support space and recovery connections are here and strong and helping people, but we're seeing all of these resources come out that are helping with transportation, helping with employability, helping people just, no one should hit rock bottom so hard that they can't get up.
Yeah.
And seeing people get up from their rock bottoms has been honestly the thing that's been the most hopeful for me. TV wise, very much so binge watch shows. So we have blown through recently all of The Walking Dead and all the spinoffs.
It's a commitment right there.
Oh, it's so many episodes, 12 seasons for the main show, 8 seasons for the spinoff. But it's funny, my partner and I last night were talking about like how every show we watch and movie we watch, like I make it work, is what she said. But I like find these little like mental health aspects. We're watching Harry Potter Part 1 episode 7 Part 1, and I was like, can you just imagine the mental toll that like it takes to be like, you know, you were magic born and then your parents are gone and you grow up and like I'm pathologizing Harry Potter essentially.
A lot of trauma to unpack.
Yeah, and so I try not to make work into like everything, but it's been really, really nice to like rewatch things I enjoyed as a kid.
Yeah.
Like loved The Walking Dead when I was younger, loved Harry Potter when I was younger, and watching them as an adult with like a totally different perspective.
Oh, that's
has been
interesting.
really
Yeah.
fun. Like invigorates that inner child
Yeah.
portion. What about
Thank
you?
you guys. For me, I would say I'm really inspired by one, the integration, but also looking at like individual journeys in wellness and not pathology, and seeing that happen in an inpatient setting and in hospitals. And, you know, that's my mission and my goal. So I'm truly inspired to see peer support in hospitals, in inpatient settings, and also inspired. I got to tour Yasmin's respite center. Center may not be the right word, but home. It's actually a home. And I think that's part of the beauty of it too, is just having a beautiful space to
So
relax
pretty.
in, and finding that like humanness that brings us together. Like we're more alike than different on every level, and I'm really inspired by that, and by all of you guys too. And I'm reading How to Think Like a Monk. So good. Love it, love it, love it, love it. So if you get a chance, pick it up. Thank you so much for joining us on My Matters today. So excited that we got to have this really important conversation. Again, if you need help, please give us a call. Visit our websites to look at our services at La Amistad, Central Florida Behavioral, UBC, which is University Behavioral Center in Palm Point. Thanks, and have a great day, everyone.